Aging happens slowly. So anti-aging doesn't have to happen overnight. Beauty is not an overnight treatment. Beauty is like a seeking, and it is a journey into your own self. It is a growth in your own skin. And yes, at some point you want it to be stable and you want to stay the same. And that's very possible, very much possible in the 21st century with all these tools at your service. Hello. Welcome. This is Dr. Din at your service. And today we are going to be talking about some peptides. We're going to be talking about some longevity protocols. And we will also be talking about Valentine's Day and what is the best thing to do for yourself if you truly appreciate being in the skin that you have. Depends on where you are in time. Everybody has a different stage in life where things carry different value. So if you're still early on in your life and you're like in your 20s or 30s, enjoy, do something nice, go out, have fun, maybe get a facial, maybe get a massage and a facial and something to cleanse your skin and whatever else is ailing you. However, if you're somebody who is in your 40s, it's different. You might be going through perimenopause and your skin and hair might need a little more support. So depending on who is looking for this support, that's how we do it. So it's like categorized. So I would suggest to everybody to just come and get a consultation first and see what is it that you're seeking or that you should be seeking, if anything. So first of all, menopause has to be recognized as a pause. So when people think of menopause, they think that this is a period of time when women start menstruating. So that means that their kitchen is closed and they can no longer produce any more children. However, menopause is not just the pause in your fertility. Menopause is an all-system pause. It is a brain pause, it's a skeletal pause, it's a skin pause, it's an immune system pause. And all of those pauses create a metabolic sluggishness in your system that makes you gain weight. So all of this cookie starts crumbling with the crumbling of your hormonal cascades that you're used to since you've achieved maturity. However, once this system closes down, it shuts down several other systems in the body. So when you understand your pause, that it is an all-system pause, women then make the correct decisions for yourself. If during this pause you're experiencing metabolic sluggishness and you've gained like 5-10 pounds over the last couple of years, despite eating the same food and having the same level of activity and doing all the other things in your routine life that can help you on your own. If none of those things are working, then when you come to us, one of the things that I would like to recommend to people is our GLP-1 agonists, which is a kind of peptide which allows your body to lift itself out of your metabolic sluggishness that is related with the pause. Now, menopause may happen to women. It has an identical syndrome that is happening to men at the same time. Men, just like women, have been gaslit for so many years, where when somebody would complain about things that were happening to them during menopause and we would say, no, that's just normal, this is how the cookie is supposed to crumble. Men, on the other hand, nobody even tells them that they're going to experience a pause also, where their hormones will decline, where their energy is going to decline, and where they will also experience their metabolic sluggishness. So the andropause is like another area where we pay a lot of mind. And for men also, we recommend not only to consider starting GLP-1 agonists that lifts their system out of its sluggishness and also restores the youthfulness in their fat cells and in their body in general. So GLP-1 agonists for somebody to consider if they're in the pause life. Another thing that I also like to tell all my clients to try is something called an intravenous infusion of nutrients and vitamins and antioxidants, which is similar to maybe what you can consider, like if you were a car, it would be akin to an oil change. However, in a human body, the oil change is done. Normally, we have a lot of experience in this particular procedure, which is basically an oil change for the human body. And the experience we have is mostly from emergency departments, from hospital settings, from urgent care settings, when people are deathly ill or teetering on the edge of some major catastrophe. That's when we stick an 0.9% normal saline or an alkaline fluid into your system, and we introduce it to cleanse your system, to hydrate you a little bit better, and to make the acidic environment of your system, which can happen with different kinds of catastrophes and crises during your life, and turn the balance into an alkaline system. Because basically what a healthy human is nothing but a chemical reaction occurring under your skin. So when that reaction is off, one of the first things we do to restore that balance is that oil change, which is the intravenous infusion that you get in the ER or urgent care. However, now, over the past decade, what has become a very routine thing is to utilize this procedure while you're still healthy, while you're well. So it's become more of a wellness promoting procedure, and that's something that we do. So our house blend includes not just that simple oil change, but also introduction of several antioxidants, nutrients, and vitamins that your body needs and is unable to get out of just your gut from things that you place inside your mouth. Because guess what? When you're pausing, one other organ that's pausing alongside the rest of your system is your gut. So your gut, by the time you're in your 50s and 60s, is just as jaded as you are. And it is not going to open its door and let in nutrients that it does not recognize. And most of the water-soluble nutrients that you will ever place in your system will get denatured as they go through the mill of your stomach, which contains this river of acid. So every food item that you place inside your system goes through this acid wash. And during that wash, of course, it also cleanses everything that you place inside your system, but it also denatures the water-soluble vitamins. And because of that reason alone, your gut biome fails to recognize some of the beautiful nutrients you may be feeding yourself during the pause, and they never get to your end organs. So to bypass that entire chaos is to go and get an intravenous infusion with your wellness doctor. And this should help you immensely, not just with energy, but with also boosting your immune system and everything else. What is the most popular IV cocktail people ask for? So at my office, people ask for different things, but I like to give them my house blend, which is my formula, and for the menopause or the andropause. And I think that is sufficient. We have worked on it for like a decade, and I think it's fairly complete in its essence. So I like to give my formula. However, you can just get like a simple hydration infusion anywhere. Even if you put nothing in that bag and you just give yourself a plain bag, with like a little pinch of vitamin C and something like Maya's cocktail or something like a little glutathione, even that is better than not doing anything. But at my office, we do something like really supremely important for the pause, and it definitely lifts you out of your sluggishness. So thanks for that question. That was very cool, Danny. What else? How can I show love to my skin this Valentine's Day? Try some anti-aging treatments. So anti-aging treatments, if you are in your 20s, you may not need medical grade anti-aging treatments. However, if you're in your 30s, if you're in your 40s, if you're anywhere else in time, you may want to try medical grade anti-aging treatments. Now, medical grade anti-aging treatments are basically medications that we insert under your skin with the help of a needle, a syringe that holds different medications. And if I can show it to you, it's a very tiny, very fine needle. It can hurt when we are injecting. It can also bruise when we are injecting. However, we do place some numbing treatments so that you don't hurt that much. And usually there is no downtime after a treatment like this, but I always like everybody to prepare for a treatment like this by making sure that you don't have any important functions happening in the next couple of days, because God forbid if you bruise, you will have to then, put all sorts of makeup and concealers to hide the bruise. Because remember, your skin is a very vascular organ, and because of its vascularity, you want to always be prepared. Even if you go to the world's best injector or the most experienced injector, such as somebody like myself, you still always have the chance of getting a bruise. I always tell everyone that if you bruise, there's no problem with that. Bruises heal. And as the bruise heals, it actually makes the fabric of your skin in the area where the blood product has collected, it always ends up getting stronger and getting nutrients from just the blood, like growth factors and stem cells and all the minerals that are found in your blood. So there's no harm in having a bruise. However, it does look a little off for a few days, and there may be people who'll be looking at you that who did your Botox or who did your fillers. So Botox and fillers are the medical grade anti-aging treatments that I recommend to people once you feel that your skin has started aging and it has come to a point in your life where you're like, okay, I see that it is still me, but I have these lines that are getting etched into my skin, and what other things that you can do. So at some point, just topical management of your skincare won't get you anywhere. And at that point, you need to consider medical grade skincare. So for sure, during Valentine season and in the upcoming season of spring, one of my most favorite treatments during springtime is something called Ultherapy at my office, which is basically a device that inserts frequencies of sound under the layers of your skin. And by doing so, it not only tightens, but also makes the fabric stronger. And this is something that is that has FDA clearance in the United States for not just a non-surgical face and neck lift, but also recently it was approved for tightening of skin for your stomach and as well as your arms. So and this is based on the premise that your skin expands all your life, and especially after you reach menopause, or andropause, the expansion and growth of your skin accelerates and leads to just sagging, because the skin it loses its elasticity and it can't hold all the fabric together. So at that point, just Botox and just fillers may not be enough. And at that point, before actually you reach that point, this is a proactive way of preparing your skin to stay together without sagging too much. So this is a proactive anti-aging treatment and skin tightening that I recommend to women, especially women who are averse to surgery, to utilize as much as they can. There are, in my experience, people who do it once every quarter, but everybody has to figure out their own budgets and see how much they can afford, because all of these treatments, because remember, skin failure is not covered by your insurance, because your insurance thinks that skin failure is a cosmetic problem. However, your skin failing will have an impact on your mind-body complex in several different ways, but we are not at a point where your insurance will start covering your skin failure. So you have to take care of that proactively. And at some point, if your skin is not responding to treatments that are non-surgical, such as a treatment with like Ultherapy, or there are other sound machines also that are now FDA approved, like Sofwave. There are Chinese companies that offer similar frequencies, which is called HIFU. And those treatments are kind of comparable. However, some frequencies last longer, some frequencies last less in people's experience. So you have to find a suitable provider around you, because you need these treatments continuously, and somebody needs to keep a track of how much energy your skin needs to bring itself back out of the pause. So definitely, if you are able to do something about your skin this upcoming spring, this is the time to start preparing for skin tightening. The last thing that I want to, at this point, this is the last week to get that done, and that is the laser. So if anybody wants like a facial rejuvenation laser, like a rosacea laser, or you want to remove some pigments or do a skin brightening treatment, please do not wait until spring to do that, because laser is a different kind of device. What it does is that it sensitizes. It's a very topical device. It's a cleaning, it's a cleansing treatment, and it also helps remove pigments. So what ends up happening is that if you do lasers during spring, your skin might develop more pigmentations and may even develop areas of hypopigmentation. So instead of your skin coming out nice and bright, a year later you might realize that your skin has spots. And that is probably because you did the laser treatment, which is the light, which harnesses the energy of light, during a sunny season. So during sunny season at Giovanni, as a rule, we just put away all our light devices, because light devices can only be used during the winter months, during the dead of the winter. And that's that. Let me see. How many units is baby Botox usually? So baby Botox is a treatment, a name of a treatment that we give to somebody who is using a microdose of Botox. So what it means is that it is the minimum effective treatment for reversing the aging of your skin. So let's say if you are chronologically 40 years old, your baby Botox dose would be half of your chronological age. So if you're 40, we would try to give you a dose like around 20. If you are 50, we will try to give you a dose of 25. I have people who are extremely good with their skincare and their self-care, and for that reason, their Botox doses never increase. And there is a reason, because they are maintaining the treatment. It's just like any other organ that your skin holds inside it. It itself is an organ too, and it needs anti-aging medications to keep itself consistent through time. And that is because these medical treatments are now available. I tell everybody to try it and find a tailor near you who can very expertly not only turn time on your skin, but also help you keep there and keep a track of your doses. Because remember, anti-aging is nothing but a code that consists of different doses of your medications. And just like for sickness management system, when you develop different sicknesses in different organs, you have diseases there and their doses need to be managed by some doctor. Similarly, health and beauty and wellness also have different medications and different elements that come together and help you stay there. So just like sickness management has medications, health management has medications too. And you have to choose which one you're going to spend money on, because you will eventually need to either spend on your sicknesses or you will proactively spend money on your health. So I tell people that when you have the choice and when you still are healthy, that is the time to start investing in your health, in your wellness, and all your health and wellness eventually will lead to the epitome of your existence, and that's where you will accept yourself and think that you are God's gift to mankind. What is the difference between Botox and fillers? So Botox is one of the world's fastest acting anti-aging medications, and it is basically a muscle relaxer. I tell people that it is we place it in certain parts of your muscles in your face so that not only it relaxes those muscles, so your muscles are not scrunching uncontrollably as you go through life and different thoughts and emotions, but by doing so, it also helps your body establish a better lymphatic flow and blood flow of nutrients and minerals to the skin, thereby creating the bending of time where your skin, wherever we place Botox, starts looking 7 to 10 years younger. So that is Botox, which is like a muscle relaxer kind of a thing. However, by relaxing the muscle, it rejuvenates your skin. However, HA filler, which is a hyaluronic acid filler, is a different kind of anti-aging medication. It is also a medicine. Hyaluronic acid is the same it's created biologically, similar to the underlying under padding of your skin. So Botox cannot be injected everywhere in your skin. So there are certain areas of your skin, like for instance around your mouth, around sometimes under the eye, sometimes in various areas of skin where we cannot arrest the movement of those muscles, because you have to talk, you have to smile, you have to make a sad face, you have to do different communications. So what ends up happening is that after menopause, your body is no longer replenishing the underlining of your skin. So sometimes if you lose too much collagen because of either weight loss or just aging, what we do is that we go and inject that collagen seeds under the skin. And that is also HA filler. It is an injectable, and we place it. It's like a seed of your own padding. And then what it does is that it creates a network of other cells and, rejuvenates the area wherever we inject it. Again, these are cosmetic procedures. So whoever does it for you, you have to make sure that they're supremely trained. They know what they're doing, they're licensed, and are able to, do justice to your face and your beauty. I personally don't like people to overdose on these medications because remember, aging happens slowly. So anti-aging doesn't have to happen overnight. Beauty is not an overnight treatment. Beauty is like a seeking, and it is a journey into your own self. It is a growth in your own skin. And yes, at some point you want it to be stable and you want to stay the same. And that's very possible, very much possible in the 21st century. I invite pretty much everyone towards anti-aging by saying that there is no reason for you to age as if you were living in the 18th century while you are living in the 21st century with all these tools at your service. What is the difference between hyaluronic acid and collagen fillers? So sometimes hyaluronic acid fillers are also known as collagen fillers. However, it's not really collagen, but it does grow into the underlying padding of your skin. So, but yeah, there are a lot of different kind of fillers. There are fillers that are like Sculptra, which is basically a crystal that once we inject under your skin, it just promotes the growth of the fat cells under your skin and its own lining. But, to each their own. Your doctor will tell you why you should do one kind or the other. None of these treatments are one and done, unless you're very young and your problem is very tiny. But mostly these treatments need to be continuous because I don't like anything permanent. Let's say that. I don't like, because human beings you are a perishable item. You are nothing but a tomato that is existing in time, and gravity and environmental elements are going through you. So you are going through that. And because of that, you don't want to place anything inside you that is too permanent, especially under the skin. I have seen nightmare cases where people get stuck with bad results just because they were trying to put something in it because somebody said that this is permanent. Nothing is permanent. And if somebody says, let me put something permanent in you, you should run away as fast as you can. The reason I like hyaluronic acid filler is, first of all, it's going to last in your system for maybe 9 months, maybe a year. However, if somebody places it and you for some reason do not like it, you can go and erase it. It is erasable. So if somebody cannot erase their work, you should be very, very careful. So that being said, there are doctors who do Sculptra. I do Sculptra myself also. However, I like to do it in the buttock. And the reason I want to do Sculptra kind of particles in your butt is because it may not be permanent, but the results, the butt is like, it's very forgiving. And it can last, a bigger padding usually lasts people like 4, 5, 6 years. And I think that it's worthy for that area, because your butt it has to withstand a lot of weight and pressure. So we can do, more longer lasting procedures there. Are collagen fillers more natural or organic? So hyaluronic acid is very biologically biosimilar. So that is what I would suggest people to do. And it's safe. In the right hands, it is safe. Listen, if somebody doesn't know what they're doing, they can hurt you with that thing. Because if it is a medication. When you start thinking that this is a medicine that somebody's going to inject under your skin, you're never going to go to somebody who's not trained. You want to make sure that, and again, if somebody says that this is for $10 and come and let me give you, Please don't go there, because these are not tomatoes that you're buying off of some fresh farm market. You gotta make sure that these are reliably sourced, and whoever is giving you has license in the area where you're living. How much filler do you recommend for a first-time treatment? I tell people to always err towards less. Less is more. Do not try to overstuff yourself, because you are not a turkey. And let's not stuff ourselves with filler. That face where you are with overfilled lips, overfilled everything, is like, it distorts features. These medications, especially anti-aging treatments, are not there to change you. They are there to preserve you. And that's it. That's how you need to view it. We are not here to make you beautiful. You are already beautiful. We are here. Making you beautiful was a job of your mother. We are here to just preserve you. And that's it. And yes, a little enhancement can come. We can help you grow into yourself as well as you can. Oh, Rose just got the #1 viewer badge. Daisy, she won. She won. Why do some doctors say that fillers move around and last for a long time in the body? Listen, I don't understand why some plastic surgeons don't want people to preserve their skin with minimally invasive treatments. It seems so unnecessary. You do not need to tell people to go back 20 years in time and then come for a surgical resection every 10 years, like all our, some of our ancestors did. Like every 7 to 10 years, women would go for through the plastic surgeon's seat, where they will, whatever skin had failed, they would chuck it out. So before you chuck and cut your skin off, you need to try your best to preserve yourself for as long as you can non-surgically. And the reason is that your skin is also represented inside your brain. So if you prematurely resect your skin, your corresponding brain cell is still there. And that is why many times when women go through unnecessary cosmetic surgery, they may end up not liking themselves even then. And remember, sometimes beauty is not something that you will get just because somebody gave you a cut or a nip and a tuck. No. So the most likely possibility is that somebody's going to fuck it up, because most people are not able to go to the best of the best surgeons. Many of the ladies now, there is medical tourism, so they'll go to some other country and do it. Now, if somebody makes a mistake, you cannot do anything to them if you go to a different country. However, what I say is that do the right thing for yourself, start doing minimally invasive treatments for yourself. And if a surgeon says that don't do, yes, the fillers can move if somebody's overstuffing your face. And especially if you're like in your 60s and you've never done anything before and this is the first ever time and you're starting with like a filler is not going to take the place of a facelift. So if you're starting out in your 60s, you may need a surgery, cosmetic treatment, so that somebody can bring you back in time. However, after that one surgery, you can maintain yourself for like a very long time with some of the non-invasive treatments. And I am a believer in non-invasive treatments. We do not like your skin being cut, and we believe that cutting your skin can be harmful, not just to the way you perceive yourself, but it may not connect you with versions of yourself that you want to get connected to. And it may not bring you the mental peace that you've done something right for yourself. However, I'm not saying that all surgery is wrong. Sometimes some people do require that surgery because if your skin has completely failed, there is no other way. And your skin will fail. If you don't do some of these small steps to save your skin will fail. That is like just the routine way that life goes. But there are also paths that can help you not need that surgery for a very long time. And I totally don't agree with surgeons who recommend not doing anything and just waiting like a sitting duck until aging hits them really bad. And one day they're so depressed that they'll take all their 401ks that they've saved up all their lives and come and give it to them so that they can give them a new face. So I'm just against that. But yes, do things with somebody who understands the use of those the medications and can be microdosing you. Because remember, only microdose. I should call it minimum effective dose. And if you do it regularly, your dose should not increase. We can stabilize you through time. All right. Who will you have as a guest tomorrow on Bathroom Diaries? Guys, please join me and my bestie in the field of aesthetics, Dr. Frankel, one of my oldest mentors and colleague, who is also the host of Modern Man podcast. And he is coming again because his last episode with me was so well received. We got over 47,000 views on his peptide playbook talk. And if you've not heard it, I will link it in this video. And you please go and watch that one. So tomorrow we are recording another episode with him, and the title of our talk is going to be Hormone Replacement Therapy, as well as his top 5 favorite peptides. Guys, since the introduction of GLP-1 and 2 agonists in our lives, the view of medicine has changed. The way we used to view our longevity, we're changing. Everything is changing. And that is why it is time to really look at these peptides. And Dr. Frankel has been working on these for over 10 years. And I think everybody's going to learn a lot from him. And if you have any questions, please send us a message, and I'll make sure if we like your questions, we're gonna feature you and we'll ask your question. Yes, I'm also excited. It's going to be a great episode. Again, peptides are, what are peptides? So peptides are these small chains of amino acids that act like they are biosimilar to your own peptides that your body produces. And what they do is that these are like text messages to your body's inner cells. And what they do is that instead of changing, or instead of being some foreign object, they basically send the message and instructions to your body to prepare its own stuff. So it's very good for the body when done properly, but they need to be studied more. And we have like several generations of these peptides already. There is GLP-3 agonist already there, and it's awaiting FDA clearance. So I am looking forward to it. Many of the people who started GLP-1 agonists for weight reduction and for just getting themselves out of the metabolic sluggishness of menopause or andropause, those people are also finding that combining GLP-1 and 2 is very useful for them. And there are also people who are looking to, change the peptide to the next one because they like the first one so much. But we also have people who are doing so well on GLP-1s that they will never switch to anything else. It's just like somebody who uses, like if any of you has ever experienced Botox. So there are like 5 different kinds of Botox now in the market. However, people who are established on Botox for the last 10 years, they are on the same dose of Botox for the last 10 years. Nobody has changed. Nobody is going to a different level of Botox. So GLP-1 agonists is like Botox for your fat cells. So it removes the pressure out of your fat cells, your cholesterol gets rejuvenated, and then you see that your blood pressure gets better. So things that we used to use 3 different medications for now can be dealt with just this one shot. And originally, your insurance may even cover it if you have diabetes. However, if you don't have diabetes, sometimes they do not cover it. Sometimes they cover it, like one of the GLP-1 agonists, also known as tirzepatide, which is actually GLP-2 agonist. And it's also known as, the brand name is called Zepbound or Manjaro. Now, Zepbound got FDA approval for sleep apnea because the fat that hangs under here for people, when you lay back down, it can cause you to have sleep apnea. It can close down on your throat. So by losing weight, they found that this is very useful, and people didn't need to go on the sleeping, the oxygen machines at night. So if you have any of those troubles, you can definitely speak to your doctor about it, and maybe insurance will cover it, because insurance is like your health insurance is like your car insurance. It covers accidents, illnesses, diseases. So if you have a disease, like you have diabetes, or if you have sleep apnea, or if you have like a lot of weight that you need to lose, then you can ask for a GLP-1 or 2 agonist, and now they are trying to reduce the cost of it also. But again, it's like Botox. So if you're on a very tiny dose of it, you might find that you will be able to get it at very cheap. However, if you're on higher doses, I think the price is the same. It is somewhat expensive. All right. Here in Mexico, I saw that Ozempic is now available orally. Is that equally effective? That's a very good question. I do not think that oral GLP-1s will be as effective as the injectable. However, there's no harm in trying. I feel that if you have to take it orally, an oral medication, it's better to go back to the older versions, like Janumet, like metformin or Januvia or something like that, because we have a lot more reliable data on how they control your diabetes. The oral Ozempic may not work that much because, again, these are peptides and they get denatured in your gastric acid, and because of that, they may not work. However, when you inject them directly into your fat cell, it's a once-a-week shot, and it does wonders for people. So no, I don't think that is gonna work. But listen, I fear that the world will be divided between haves and have-nots, and people who will have resources will be on the superior form of GLP-1 agonists, and those who do not have the resources will have to find cheaper ways. So because insurance is constantly seeking cheaper ways, even if they are less effective. And I feel that that is the next battle that your doctor will have to fight with your insurance. Do GLP-2 get injected on your double chin to reduce the size like Kybella? No. So GLP-2, like tirzepatide, again, it is basically reduction of weight, overall weight. But sometimes, when you reduce weight, sometimes from the face, weight goes first. So that's why they just got an approval for it, but it's not Kybella. However, I firmly believe that by using Kybella, you can improve your sleep apnea if fat is making making your breathing labored at night. But Kybella is like a fat melter. It's a local fat melter. So it's an injectable. It's a totally different process. It's not a peptide. All right. I think lip flip can be done with Botox, or you recommend lip fillers instead. So lip flip is basically done with Botox. Basically, we place it in a way where so some people have like a muscle that is like turning inwards, and they have like a nice lip, and they want to experience their lip to be like a little outwardly, tilted. And that can be easily done with a little bit of Botox. However, sometimes when you place lip flip, what it also does is that it slows the movement of the muscle around your mouth. And then people sometimes talk funny. Sometimes they smile. Their smile looks funny. And the worst is that sometimes when they're eating, the food can fall out of your mouth and drinks can fall out of your mouth because you may not be able to close your mouth as quickly as you need to when you're trying to chew and eat. So it can sometimes be weird when you're doing Botox flip. Now, if you are considering a filler, and now filler is way more expensive than Botox lip flip. So before you place a filler, if you want to see what a filler will look like, you can do a little Botox flip to see what your lip will look like, because Botox is not going to last that long. A Botox lip flip usually lasts like maybe a month or two. So a filler lip flip, on the other hand, can last you way longer. So before you go for a more longer lasting procedure, it's always good to look at your stuff and see what it looks like and if you're going to like it. I hope that answers your question. Okay, I think I saw in your recent episode of Peptides that there is a glow peptide. What does that peptide do? So glow peptide is for the glow of your skin. And I just started doing glow peptides separately. Now, glow peptide is something that you will have to inject yourself. So this is something that is safe. We prepare it, we give it to you, and you inject it yourself. So it is something that can help the matrix of your skin get stronger. It has a little bit of copper in it also, which like really makes your skin firmer. So people not only experience a very nice glow in their skin, but also firmness. So it is something that, how can people join the podcast with Dr. Frankel tomorrow? So the podcast with Dr. Frankel tomorrow is just going to be with me because I'll be recording it. However, once my recording is complete, I will publish it on all my forums, and you'll be most welcome to go and watch it. And if you have any questions for my talk with Dr. Frankel, please feel free to make a comment or send us an email, and I'd be happy to ask your questions. And even after the podcast is done and uploaded and you have any questions, follow-up questions, please feel free to connect with us, and I'll be happy to bring Dr. Frankel back, because I am planning to have him come on my podcast as often as he can, because there is just so many things that he does. Do you recommend Botox or fillers for crow's feet? So crow's feet are the little crinkles that appear on the sides, on the corners of your eye. Now, these lines that appear around the corners of your eye are very important. This is how people, when they are talking to you and you smile, your smile looks real and not fake, because you have a little crinkle on the side. So when to release, however, nobody needs like a big ass crinkle that is like etching in your skin over here. So when it starts etching in your skin, we try to erase and soften that look with a little bit of Botox. I don't like to do fillers in this area unless you really need it. However, if somebody has like a really lot of loose skin over here, we also do skin tightening there. And listen, if you have never found out about all these things and you let a lot of time pass you by, then you will go to a plastic surgeon and they will do an upper and lower bleph and give you new skin. Please follow us if you don't already. And please look forward to my podcast, which is tomorrow. And it's going to be with Dr. Frankel. See you soon. Have a great day. Bye-bye.